The conclusion of the study is the combined relationship of BMI and physical inactivity are significant predictors of type 2 diabetes in women. The study reveals a reduction in risk for type 2 diabetes with an increase in physical activity. However, opposingly, the risk can suddenly increase when BMI levels are high. Some links to current literature that support the study is one found in the Nurses' Health Study, which backs up how those women who classify as overweight and obese are the strongest predictors of diabetes. Another literature is the Diabetes Prevention Program. They carried out randomized clinical trials in diabetes prevention, focusing on those with impaired glucose intolerance. This overall just defends the study's results that lifestyle modifications, such as increases in physical activity, slight diet modifications, and overall weight loss, are way more beneficial than any form of metformin therapy. And this just overall reduces the chance of developing diabetes, which brings us back to the study's results. Another link to literature was the Dai-Quing Impaired Glucose Intolerance and Diabetes Study. This study compared diet and exercise, and this found a similar reduction in the risk for diabetes when BMI is overall just controlled. BMI can just be controlled through increases in physical activity, through those lifestyle modifications, and that just goes back to support the study's overall result. Tumilita et al. Is another study which also tested the improvement in diet and exercise and how it just goes back to reduce the overall risk of diabetes. This, again, highlights the lifestyle modifications. Increases in physical activity can just form to affect your BMI levels, which reduces the risk of diabetes. Blumenthal et al. Was another trial that was different than the other ones, but it has the same relation back to reduce the risk of diabetes. It focused on hypertension patients and focuses on how weight loss is a greater effect on the reduction of reducing fasting glucose and insulin levels. So this is consistent because when glucose levels and insulin decrease, so does the risk for diabetes. This is explained by weight loss's target on decreasing adipose tissue. This adipose tissue has great effects on insulin's metabolism. And therefore, with insulin's metabolism being restricted by the adipose tissue, it is an overall increase on the risk of diabetes. But when weight loss targets these fatty acids that are found in the adipose tissue, the risk of diabetes is overall reduced.